CODE's program on open data for racial equity is designed to support efforts to advance racial equity in the US, with a focus on finding ways the federal government can partner with outside groups to develop data-driven solutions. CODE identified healthcare access, fair housing, workforce opportunity, policing and criminal justice, and climate and the environment as core priority areas. The program was initially developed in response to national turmoil and the call for racial justice sparked by the killings of George Floyd and Breonna Taylor. Our aim is to evaluate the landscape of racial equity data and improve its access and align such efforts with federal priorities. We chose to focus specifically on racial equity to contribute to the national conversation and promote data-driven solutions. CODE utilized a variety of methods to gather information on this project, including stakeholder engagement, surveys, desk research, and interviews. We also used a number of open data resources and platforms for this project, including data from the US Census Bureau, the Black Wealth Data Center, and more. We then used Esri Story Maps platform to create the interactive maps and visualizations I'm going to show you now, with a lot of help from the experts at Esri who are at this event today. CODE has explored how data related to health risk, healthcare access, and health outcomes can be leveraged to reduce disparities and improve health equity in the United States. The healthcare story map illustrates the problem of healthcare disparities, the data and policy landscape, lessons learned from COVID-19, the importance of the social determinants of health, and potential of emerging health technology. Here, you can see the CDC Social Vulnerability Index, or SVI, which is one of the most widely used resources. It's designed to help officials and planners identify communities that will need the most support before, during, and after a hazardous event. This is a similar map of Pennsylvania, which looks at social vulnerability by county. You can see data down to the census tract level as well. You can see that Philadelphia stands out as a county with the highest degree of vulnerability. As you zoom into a more granular view, you can see data down to the census tract level. You can review the Pennsylvania SVI and link documentation to understand the 16 social factors comprising socioeconomic status, household characteristics, racial and ethnic minority status, and housing type and transportation. I'm now going to show you the housing section of the website to show you another helpful feature of the story maps. Open housing data can be used to demonstrate the ongoing effects of historical housing discrimination, develop targeted desegregation efforts, connect minority communities of color to credit, and much more. Black and other communities of color face a number of obstacles relating to housing and homeownership, including discriminatory housing practices, mortgage lending discrimination, and affordability. On the left side of my screen is a map of Richmond, Virginia. This is a redlining map from the 1930s. It shows how the Homeowners Association America identified desirable neighborhoods, which are in bright green, and least desirable neighborhoods, which are communities in red. The map on the right depicts a social vulnerability map from 2022. By using the slider in the middle of the map, you can see that the relationship between historically redlined areas and social vulnerable areas today. Now, let's head to the workforce section. So this section explores how open data can help improve opportunities for people of color to achieve equity in the American workforce. Data and analysis can help identify and combat unconscious bias in hiring and analyze the availability, quality, and efficacy of job training and education programs, and much more. Issues like unconscious bias in recruitment, discriminative job requirements, and poor access to education and training, and disparate outcomes add to disparate outcomes in our workforce. Similarly to the housing section, the workforce section outlines these major issues and also uses the slider tool to present different maps. In this section, we've combined two maps that show how poor educational opportunities can contribute to poor employment. The map on the left shows workforce disadvantaged areas according to the Climate and Economic Screening, or CJES tool. Areas in blue are designated workforce disadvantaged. On the right, you can see the location of the community colleges that self-identified as Hispanic serving in data submitted to the National Center for Education Statistics. As you zoom in, you can see large areas that are workforce disadvantaged and don't have Hispanic serving community colleges, suggesting that a lack of educational opportunities can be an issue. So here you can see correlations in San Antonio and Houston. So that gives you an overview of how we've approached these different kinds of issues: healthcare, housing, and workforce opportunity. I hope you'll browse this platform after today's discussions and share with your wider networks. Please take the time to enjoy and provide your feedback on this last page. Thank you.